identified a single patient who came in, had exposures at 2 different healthcare facilities and in the community. We monitored more than 60 contacts every day. None of them became ill. So this kind of contact tracing really is core public health, and it's what we do day in and day out, and what we will be doing here to identify any possible spread and to ensure that there aren't further chains of transmission. On the phone, 2 more questions.
The next question is from Julie Steenhuisen of Reuters. Your line is open.
I have 2 questions. First, I just want to confirm the timeline. So my understanding is the patient arrived in the United States on the 20th, initially sought treatment on the 20th, I'm assuming was then sent home and came back again on the 28th of September and was admitted. The second question is, will you be offering this patient any convalescent serum or experimental therapies? Thanks.
You are correct about the timeline. In terms of possible experimental therapies, that's something that's being discussed with the hospital now and with the family, and if appropriate, would be provided to the extent available. A last question on the phone.
The next question comes from Denise Grady of the New York Times. Your line is open.
Thanks very much. I think that people have touched on this, but I would just like to ask this anyway, just in case we can get any more clarity on it. Can you tell us if this person is an American citizen? Will you be releasing the flight information? And is it correct to assume that he was staying at a home with family members rather than in a hotel?
The patient was visiting family members and staying with family members who live in this country. We will contact anyone who we think has any likelihood of having had an exposure to the individual while they were infectious. At this point, that does not include anyone who might have traveled with him because he was not infectious at that time. And you asked a third question, which I don't remember.
I asked if he's an American citizen.
He's visiting family who live in this country. Do we have any other questions in the room?
Just to follow up on that, will you identify the flight information?
We will identify any context where we think there is a risk of transmission. At this point, there is 0 risk of transmission on the flight. The illness of Ebola would not have gone on for 10 days before diagnosis. He was checked for fever before getting on the flight, and there's no reason to think that anyone on the flight that he was on would be at risk. I want to end with just a bottom line before we stop. Ebola is a scary disease because of the severity of illness it causes, and we're really hoping for the recovery of this individual. At the same time, we're stopping it in its tracks in this country. We can do that because of 2 things. Strong healthcare infection control that stops the spread of Ebola, and strong core public health functions that trace contacts, track contacts, isolate them if they have any symptoms, and stop the chain of transmission. We're stopping this in its tracks. Thank you very much.
Thank you, Dr. Frieden. This concludes our Ebola media briefing. For any media who have additional questions, they're welcome to call us at 404-639-3286. Thank you.